And God said, "Let there be light." And there was light. And God saw the light, that it was good. And God divided the light from the darkness. And with the light came one of the greatest miracles of life, the precious gift of sight.
At Southern Eye Center, we are dedicated to preserving your sight. We do things differently here, where we have a uniquely broad range of specialties. Each of our doctors is fellowship trained in one particular area of eye care: retina, glaucoma, cornea, eyelids, LASIK, and cataracts, the most common treatable cause of vision loss. Cataracts, which cause cloudiness in the vision, are at the heart of what we do here. Our surgeons perform thousands of cataract procedures each year. In fact, over 50,000 cataracts have been safely removed in our surgery center. And just like everything else in life, we believe more experience results in higher quality care. Southern Eye Center was founded in 1975 by Dr. Lynn McMahon, who pioneered many techniques for cataract and intraocular lens implants. Since then, we have invested millions of dollars in state-of-the-art equipment and technology to provide our patients the highest quality and up-to-date options for cataract care. Our doctors have lectured on nearly every continent, and articles about our work here have been published in many magazines and medical journals. In addition to quality care, we have worked very hard to fine-tune the patient experience and make it as convenient as possible. All of this allows us to offer you a one-visit procedure. You benefit by having everything done in one day, resulting in less time off work, a safer procedure, and fewer post-op restrictions. In fact, our motto is "One visit is it." I'm Dr. Kipper Nelson, Chief of Cataract and Implants here at Southern Eye Center. In this video, we're going to take you on a virtual tour of what you will experience when you come to us for your one-visit cataract procedure. But first, let's see what some of our former patients have had to say about us.
I could call it a delightful experience. Everything went smoothly. I was treated in a manner that made me feel very special and very cared for.
I expected it to be kind of cold and clinical, but these folks here know how to have a good time and make it a pleasant experience.
It happened just like he said. There was no pain or anything whatsoever.
When I first got here, I was extremely nervous. I didn't know what to expect. But it was first class from the very beginning. Everybody treated me well. The nurses made sure that I knew who they were. They even held my hand during the surgery. And Dr. Nelson, as bad as it was, he sang to me.
When you walk into our reception area, our staff will greet you warmly. Because we need to know as much about you as possible, we ask that you take time to accurately fill out your patient information. After recording your health details, our technical staff will begin an in-depth examination of your eyes.
Very good.
Can I borrow your glasses?
They will check your vision and measure the prescription of your eyes.
Okay.
They will also measure the front of your eye to find out if you have astigmatism, which causes blurry vision. If present, your astigmatism will need to be treated to give you your best eyesight. At this point, the technician will use drops to dilate the pupil so the doctor is able to fully examine the structures in the back of your eye.
Have you hold on to my
We will also
right
check
here.
you for glaucoma.
And perfect.
Now is the first time you will see your surgeon and discuss your treatment. All right, what's going on? Rest your chin in there. We have fully examined and measured your eye, but you've got a big cloudy cataract that's causing problems with your vision, and have found that you have cataracts. What we can do to help you is get that cloudy cataract out of the way.
Okay.
And it'll help you see better. So now it's time to make a very important and informed decision regarding your lens. This is your chance to get the vision that you've always wanted. Depending on the specifics of your eye, your visual needs, and budget, we can fit you with a lens that's perfect for your lifestyle. You will have seen the lens menu in your cataract packet, so let's review your lens options. Option 1. We can replace the cataract with the standard issue lens, which is covered by most insurances. This lens is certainly better than looking through a cataract. However, it is older technology, and you can expect to need glasses for both near and far vision afterwards. For those with astigmatism but a limited budget, a procedure to enhance the vision by reducing astigmatism, or LRI, may be needed for a small fee. Option 2. For patients who don't mind readers and want the best distance vision, we offer a high-definition lens or a toric lens for patients with astigmatism. These lenses do carry an additional cost. However, you will see the difference every day for the rest of your life. Option 3. The multifocal lens is the ultimate lens technology, allowing patients to see both near and far, virtually eliminating the need for glasses. This is the lens for patients who hate glasses and want to live an active, unencumbered lifestyle. Again, this lens carries an additional cost, but also has enormous visual advantages. Whatever lens option you choose, you can feel good about your choice to come to Southern Eye Center. By having your procedure done here, you are saving 42% off the cost of having it done in a hospital. We leave the choice to you based on what you want and what you can budget for. But remember, whatever you choose is for life. The operation cannot be repeated again. Once the lens choice has been made, we need to measure and calculate the appropriate lens power.
Open wide.
Because we are improving your vision in just one visit, there is much to be done. Be prepared to spend a few hours here as we do all the testing, examination, and surgery in one day. Though it makes for a longer visit, it will save you and your loved ones from multiple trips and taking more time off work.
All right, good.
Now you will be taken to the surgery center where you will be prepared for your procedure. No hospital gowns here. We just put a paper gown over your own clothes.
Have a seat right here in this chair for me. Just have a seat right here for me. I'm going to put a hat over your head.
And then check your blood pressure and heart rhythm before we proceed.
Then we're going to put some drops in your eye.
A nurse will then place more numbing drops in your eye to prepare it for the procedure.
One more drop.
We use no needles or shots, so there's nothing to be afraid of.
Got you some extra.
The nurse will offer you some relaxing medicine if you are nervous. The procedure is tolerated very well with just drops, and because there are no strong medicines used, virtually anyone, regardless of medical problems, can have the procedure. So now you're in the OR, and the first thing that happens is the nurse will wash your face to prepare it for the procedure. We really try to make the OR a very happy and relaxed atmosphere. The nurse will hold your hand during the procedure, and usually the surgeon will talk or sing to you. I often sing or whistle to my patients during their procedure, which I think is relaxing or at least a pleasant distraction. I've had some patients tell me that I can't carry a tune, but that's okay. If that's the worst part of the procedure, then I know it's going well. The operation itself takes between 5 and 10 minutes. I make a small incision at the side of the eye and then vacuum out the cataract that caused your cloudy vision. When it is removed, I place your new lens implant where the cataract had been, providing you the best possible eyesight. And no stitches or eye patches are needed, so the eye can heal naturally with little to no downtime. Over time, the sac that holds the lens may cloud over, requiring a simple in-office YAG laser treatment. We relay the operation through TV monitors so that your loved ones can follow your procedure in the family room. Once the operation is complete, we ask that you put on dark glasses, which you will wear for approximately 1 week. Immediately after your operation, you will be able to walk out normally and then join your family and friends to relax until you feel ready to go home. Be sure you have someone here to drive you when you leave. Did good. Congratulations. The cataract came out very Finally, we will give you some simple instructions to follow, explaining how to care for your eyes when you are back home. And we give you some eye drops to use for the next few days. You will be able to carry on with your life as normal almost immediately, but now with better vision thanks to your new lens. With its pioneering history, Southern Eye Center is the place to come for cataracts. We have worked for over 30 years to build the best possible team and system to take care of our cataract patients. And remember, the cataract procedure is the safest and most effective procedure in all of medicine. But let me leave the last word to our patients.
What I can see now, as opposed to where I was before, I feel like I've just been given new eyesight.
The next day, I actually went out and fired my weapon that I have to use in my job out in the civilian world, and I fired the highest score I ever did. And I was seeing things I hadn't seen in a long time.
I was very amazed with my driving and seeing things on the computer and reading a driver's license, the small print. Very amazing. Just everything looks clear.
I was on the way home with no glasses. I could read road signs. And I hadn't been able to read road signs without glasses since I was 8 years old. So I was just totally amazed.